Hi, my name is Dr. Catherine Sims. I'm an adult rheumatologist at Duke University, and today we're going to review the Vasculitis Foundation's Reproductive Discussion Guide for men and women with vasculitis. This handout covers topics including pregnancy planning, birth control, and infertility. It is meant to serve as a conversation guide between patients and providers. Please ensure to discuss with a medical professional before making medical decisions. If you are not planning on becoming pregnant in the next year, you should have a birth control plan, as unintentional pregnancies can be life-threatening and devastating in people living with vasculitis. In this section, we will discuss birth control options for men and women with vasculitis. This is an overview of the birth control handout. We will discuss different birth control options and how well they work. It is important to understand that birth control does not impact vasculitis activity or interact with medications typically used to treat vasculitis. Birth control is recommended in all women of fertile age with vasculitis who are sexually active and not planning on becoming pregnant in the next year. Not all birth control options equally prevent pregnancy. The most effective options include tubal ligation, also known as getting your tubes tied, subdermal implants such as Nexplanon, and intrauterine devices or IUDs. Tubal ligation is used when permanent birth control is desired with no plans for future pregnancies. Subdermal implants are placed superficially under the skin by a gynecologist in clinic. There are several options for IUDs, including hormonal, non-hormonal, short-term, or 3 to 5 years, and long-term, up to 10 years. We encourage you to discuss which IUD fits your needs with your gynecologist in clinic. All these options can be used by women with vasculitis and/or a history of blood clots. Less than 1 out of 100 women will become pregnant when using these birth control methods. If you are sexually active with multiple partners, we would also recommend using condoms to prevent contraction of sexually transmitted infections. 6 to 9 women out of 100 will become pregnant when using these birth control methods for 1 year. Less effective birth control options include Depo-Provera injections, oral contraceptive pills with estrogen, vaginal rings, patches, and the mini pill. You will notice an asterisk next to the first 4 options. This indicates these options should not be used in women at increased risk of blood clots or those with a history of blood clots. We recommend discussing your risk of blood clots with your doctors prior to starting these birth control options. 10 to 25 women out of 100 will become pregnant when using these birth control methods for 1 year. The least effective birth control options include diaphragms, sponges, cervical caps, spermicide, and fertility awareness. Fertility awareness is the utilization of smartphone apps and other methods to track one's menstrual cycle and avoiding sexual activity during times of high fertility. While we do not recommend these options as the primary form of birth control, they can be used in combination with previously discussed options to further decrease risk of pregnancy. If you are currently pregnant and have a history of vasculitis, please register for the Vasculitis Pregnancy Registry or VPREG database using this URL or QR code. We are interested in hearing your experiences regarding birth control, conception, pregnancy, birth, and breastfeeding. Your experience and participation will help other women with vasculitis have safer pregnancies. For additional resources, please visit the following websites. Bedsider.org provides additional information regarding birth control options. ACOG.org/patients, created by the American College of Obstetrics and Gynecology, has several resources discussing birth control, conception, pregnancy, and breastfeeding.